when you first deal with the onset of BPH is, you really just want to monitor your PSA levels. That's that prostate screening antigen that we all look for. What's causing it to grow? How fast is it growing? That kind of thing. And there are some age-related numbers you need to work with there. But the only way you know for sure is get a blood test. And they're not very expensive. So when you get that blood panel back, take a look at your PSA numbers. And then schedule a visit to your physician, because they'll be able to help you out. But some of the secondary problems we see with BPH is a constricting of the urethra and retaining a lot of fluid or urine in the bladder. Over time, bacteria begins to build up in large enough numbers that we see some of these infections starting to show up. And then there's the problem with just bladder function. You stretch that bladder enough, this doesn't want to go back into its original shape. So now we have problems with that. So what are we going to do? We can do medications. We can go ahead and do some minimally invasive procedures. If it gets bad enough, there are some more invasive procedures like the TURP or laser, the green laser vaporization that help open up the passageway. But all of these need to be discussed with your physician. The idea here is this: monitor the symptoms. Get with a physician. Understand what's going on. What's your age-related PSA level. So the only way we're going to be able to take care of this, get to your physician, get the treatment you need.